Well, hello, everybody. Good morning. I'm Bex Hayhoe, and I'm the Executive Director of United to End Homelessness with Orange County United Way. And I'm really excited to kick off today a two-part series looking at young adult homelessness in Orange County. This series is being co-presented by Orangewood Foundation and Covenant House, California, to great organizations in our community that are looking to find solutions to youth and young adult homelessness. And joining me today, I am really excited to have two fantastic experts from two different organizations here that are hard at work in our local community. So today I'm being joined by Tiffany Mitchell, who is the Chief Program Officer with Orangewood Foundation, and also by Shelby Feliciano-Sabala. And if I pronounce that incorrectly, when you introduce yourself, tell us all the right way to say that. The Chief Partnership Officer with Project Hope Alliance, a fantastic organization here. So thank you to both of you for joining us today. Before I get any further, I would just love to hear from each of you a little bit about yourselves and what brought you into this work to come alongside youth and young adults and to work to solve homelessness. So Tiffany, I'll start with you.
Of course. Thank you for inviting me here today. So, Bex, you did introduce me already, but a little bit about myself. So I have my doctorate in applied clinical psychology. I've been working in the nonprofit sector for going on 20 years now. And a lot of my work from the very beginning has been focused on homelessness, whether it's family homelessness or youth homelessness, and really looking at underserved and minority populations. And so, after going through schooling and, thinking a little bit about, do I want to do some private practice work? I realized that my heart was in community-based work. And so I wanted to take all of my education coupled with my experience and apply it back to programming, design, strategic thinking, really wanting to do some systems work and move the needle when it comes to homelessness. And in my role at Orangewood, I'm really, really focused on how do we make a difference when it comes to ending homelessness for transitional age youth. And I know we'll get into that in a little bit.
Thank you, Tiffany. It has been so fun to have come alongside you, to get to continue the partnership that we've had as two organizations. And I love what you were saying about taking your expertise and everything that you've learned and using that to be a change agent. And I can confirm you are doing that, which is just fantastic. Shelby, how about you? How did you end up in this space? What's your role?
Yeah, so it is Shelby Feliciano-Sabala. So yes, I know it's a mouthful. I am a social worker. I've been in nonprofit for over 15 years in different realms, but always with women and children and in education. So I'm currently pursuing my doctorate, and I'm studying how social emotional learning impacts youth experiencing homelessness in their school experiences. So this is something that I'm very passionate about. And I think especially with our transitional age youth, there's a lot of great work being done. And at Project Hope Alliance, I feel like I have the best job because I get to oversee all of our programming, all of our case managers. We do on-site case management with school partners. So we work directly with our school partners to ensure that our youth don't have barriers to succeed. And yeah, I oversee programming, I oversee our public partnerships, and then all of our impact and data, which is also my love language. I love data, I love statistics, and I love program evaluation, which is what I've done also for the last 10 years.
That's awesome, Shelby. I did not know that you were pursuing your doctorate. I am feeling like I need some more letters after my name now. Being surrounded by the two of you. That's fantastic. So today we are really going to be talking about youth and young adult homelessness here in Orange County. As I mentioned, this is a two-part series, and so part two will be coming up soon, and that's where we're going to start looking a little bit more at statewide and national trends. So I would encourage anybody who's watching to join us for the second part. And if you're new to our community chat series, I'll just kind of give you the lay of the land. So when people sign up to register, they're able to send in the questions that they have. We take those questions, we use that to help shape the agenda for the conversation. This conversation will then, it's being recorded, it will go up onto YouTube. So we have a whole library of all of the different chats that we've done available on our YouTube channel. And I'm sure the link to that will pop in the chat box. But today, let's get started by talking about definitions, because there are a lot of different definitions that are used when it comes to talking about youth and young adult homelessness. And that can get really confusing because all the definitions have got different sort of eligibility criteria. So let's just begin. When we say youth and young adult homelessness, what do we mean? What are we talking about? Who has definitions? Shelby, we'll start with you.
I love that you started with this because there are so many definitions for homelessness from the federal government, from different agencies. So I think the first one, since this is a transitional age youth chat, is to start with what is a transitional age youth? And it's those youth that are 18 to 24. And we work with youth from ages 5 in TK all the way through age 24. Another definition that a lot of people don't know is there's multiple definitions of homelessness. So the Housing and Urban Development, or HUD definition, is a little more rigid. And for someone to be considered homeless is different than the McKinney-Vento, which is the educational definition, which is what we operate under at Project Hope Alliance and what our educational system and our schools operate, meaning that we include those who do not have stable housing at night, but may sleep in different areas, also known as couch surfing, or if they may sleep in their cars sometimes, but might also be sleeping on a kitchen floor sometimes, or for those families that are called doubled up or tripled up. So multiple families in one home. So a lot of our families, we have a family of 8 sleeping in one room. And not just multi-generational families, but living that way due to economic circumstances.
Thank you, Shelby. Tiffany, anything you want to add in here to the definition discussion?
No, I think Shelby clearly kind of articulated everything. I think there is a lot of conversation, and Bex, you and I were just talking about this, earlier, that even at some recent meetings we've been to, there was a misunderstanding about what transitional age youth, what is the age range for transitional age youth? And some people are saying maybe it's 16 to 24, or is it 18 to 25? But as Shelby mentioned, the HUD's definition of transitional age youth is 18 to 24. And at Orangewood, we operate under that definition as well.
So I know when we do our homelessness 101 class as United to End Homelessness, this is something that we talk about because the numbers are different. They are very, very different. And I know we'll get into that under those different definitions. And so it's one of those things that I always like to really make sure we tell people that 2 different federal departments have 2 different definitions of homelessness. And that is why you will hear 2 different numbers when it comes to talking about youth and young adult homelessness and child homelessness in our community, and that neither of those numbers aren't wrong. They are different because of those different definitions. So thank you for helping to really highlight that for everybody who's watching today. So let's get into the numbers. As many of the people watching are probably aware, the point and time count numbers for Orange County were released about 2 weeks ago. And for anybody who doesn't know what a point and time count is, HUD requires every community that receives federal funding to do a count of who is experiencing homelessness in their community. And the local jurisdiction that is responsible for that is called the Continuum of Care. So Orange County has the Orange County Continuum of Care. They're responsible for making sure that the point and time count happens. It has to happen in the last 10 days in January. In our community, following HUD guidance, there we go out to count over a 3-day period. And so during that 3-day period, there are volunteers out morning and night, trying to find people who are sleeping outside, who are unsheltered under the HUD definition. And then there's a separate team that actually our 2-on-1 team looks at who is in shelters during those 3 days. And so it gets deduped. We end up with the number of people that were experiencing homelessness that were either in our shelters and being able to be accounted for there, or the people that were seen experiencing homelessness outside. And so that's the methodology. I want to say that as a sort of preamble before we get into those numbers, just to help explain a little around the methodology for the point in time count. And the point in time count is a little snapshot. It's a window into what was happening over those 3 days in our community. And I think we have a slide that we're going to pop up on the screen here to show 2019, 2022, and 2024, the differences that we're seeing around those numbers for young adult homelessness in Orange County. And so what we have here is, it's so small on my screen, but I've got it now. I've got the key. Blue is unsheltered, orange is sheltered. And so you can see that the numbers have been changing a little bit, but we have had a pretty significant increase in young adult homelessness in 2024. And I'm gonna pause here because I realize I've just talked a lot about the PIC count. Tiffany, when you saw these numbers, what came to your mind? What sort of jumped out to you?
There you go. In all honesty, what jumped out to me was that these numbers are still considerably low. We know just in Orangewood, last year we saw over 17 young adults who were experiencing homelessness or at risk of homelessness. And we actually this year served as a location for young adults who are experiencing homelessness. Like we were one of the, I'm forgetting the term for it, but we were one of the sites for the PIC count. And while I think we did a great job of helping to bring young adults who are experiencing homelessness in so they can be counted, we also know that there were still many that weren't represented. And also if we look at the way that we count, right? So in youth homelessness or young adult homelessness, a lot of youth experiencing homelessness may be couch surfing, or they're staying with acquaintances, or maybe they're in a motel. And so these are forms of homelessness. These are youth who aren't reflected in the 308 count. And so I know that at Orangewood, we're serving not just those that are literally homeless, but those that are at risk of homelessness or experiencing homelessness that falls outside of HUD's definition. And so I think what I want to do today, my hope is to kind of shed light on those invisible young adults who are also experiencing homelessness, but not reflected necessarily in these numbers or in larger conversations about homelessness.
Thanks, Tiffany. And I think just to kind of add to that before I pass over to you, Shelby, is that the increase for unsheltered homelessness amongst youth went up by about 49%. And overall between 2022 and 2024, across the board, it was a 28% increase in homelessness between 2022. But to see that young adult homelessness rose almost 50%. So that is significantly higher than we see across the general population. So just wanted to highlight that before I pass to you, Shelby, for your thoughts.
Yeah, thank you both. And Tiffany said it so well. That was my first thought too, was right now we have over 50 seniors. And again, our one qualification for our program is experiencing homelessness. So, and we're already serving almost 100 ourselves as an agency. And so when this is a 3-night count, they may be, as you were saying, Tiffany, staying with a friend on one of those nights and not be counted. And so I think it's really, I would hope that we can expand some of that or utilize other resources to help count that, because there's a lot of people that are doing work, like what Tiffany said, being one of the sites to count, or working with the community colleges. There's a lot of our youth are going to OCC, Golden West, SAC, and, navigating that while Cal State Fullerton, right? The Arte are going to all of these schools, San Diego, and they're not showing up on this count. And so the other thing with point in time count, the reason it's also important is because that's how resources are dictated. So we talked about the two definitions of homelessness, but all of the housing resources are contingent on the HUD definition only. So some of our youth will never make it into the line to get housing because they're not technically considered homeless. And so it keeps perpetuating. They're trying to have a college experience, have a career while they're doing all of these. They have significant barriers and challenges. And so I also think it's undercounted. And so the increase, it doesn't surprise me, but it is because our kids are growing up into adults, right? And
I think one other part that I'll highlight and just sort of I think this is a great opportunity to talk about data and data that's coming into the system. And another way that we're able to kind of look at numbers is that, as talking about the homeless management information system that is used for the continuum of care and is used to also, it's a different data set outside of the point in time count to see who's experiencing homelessness, how are they moving in and out of the system, what resources are they getting connected to. And I know that it's only been over the last few years that we've seen more youth serving agencies being able to enter their data into that system. So I think that's just something else that we might want to highlight, to talk about, is that it may not be that we are, I think we're getting some more visibility now into the fact that youth and young adults are experiencing homelessness, as we're seeing more agencies participate in that system. So it's bringing it more to people's consciousness. And Tiffany, I don't know if you want to share a little bit about that.
I do. Well, I'll start by saying you're 100% correct. I think that the more we can get organizations participate in sharing their data into HMIS, the more robust amount of information we'll have to pull and look at and really understand trends and what youth are experiencing that are coming through the system. And I know for Orangewood Foundation, it was just approved through the Continuum of Care Board yesterday, that we would be able to participate in a API integration. So where our native system, Apricot, will be able to integrate with HMIS so that we can import all our data automatically into that system. And honestly, it's not just to eliminate double data entry for our team, but it's also to share all of the other information that we have in our system that isn't being captured in HMIS. So now all of our non-HMIS or county projects will be captured into HMIS, so that we're sharing now a lot of our transitional housing information, all of the other information on our young adults who are experiencing homelessness, in ways that we haven't been able to in the past. And so I'm excited about this opportunity. I think we're leading the way for other nonprofits to be able to do the same. And hopefully over time, we'll start to really have a real reflection of what youth and young adult homelessness looks like in Orange County, because we'll have the data collected in one shared system.
Shelby, I can see you nodding along, and I know that you were at the COC board meeting yesterday when this decision was made. Is there anything you want to add in here?
I just think that's great, having an API for that, because exactly what Tiffany is saying, there's things that people doing the work are capturing that's not in the system that could really build a lot of context to what some of those challenges and barriers are. And we know that decisions are made by data. We are not entering into the HMIS as of right now. It's like a small fee associated with it. But I definitely think the that API integration is, I truly think, Tiffany, that's going to be a game changer for this work and for our youth. I hope that model gets to be replicated.
Well, another United Way, for anybody who's not familiar with sort of the setup here, United Way is now the operator of 211, and with that, the operator of HMIS. And we are so excited to be able to start seeing these technology solutions be able to be rolled out. And if we have anybody watching that's like, oh, I want to learn more about how technology can help revolutionize the homelessness space and ensure that we have better data that can be used to advocate for more funding and all of those things, please feel free to reach out. We would love to share. But I join both of you in your excitement about what this could mean and how this is going to roll out. So we're going to shift gears a little bit now, and I would just love for you to share a little bit more about what each of your organizations are doing. And Shelby, earlier you said something that you have 50 seniors enrolled. My brain, because in the homelessness space, when I hear seniors, I think older adults. I don't think that's what you were meaning. So I want to highlight that and ping that back to you. Can you share more about the programming of Project Hope Alliance?
Thank you so much for that. I think oftentimes, we're in our own little space and we kind of speak in not so much jargon, but high school seniors. So our work is very different because we are embedded directly on school campuses. So we get to work with the school administrators, counselors, community facilitators. Again, these staff members that know our families and know our kids, and that's where we're getting our referrals directly. So they'll say, hey, I think you should go talk to this family. And so we'll have a conversation of, what's going on. And that's really where we make our case plan. And so the one also, so earlier we talked about definitions, but another piece of it specifically with McKinney-Vento is that's typically requested during school registration, which, as you know, only happens once a year. And families have to self-identify for them to be considered McKinney-Vento based on, there's 6 total criteria, because there's also unaccompanied youth and fleeing from violence on top of motels, couch surfing, unsheltered, and living doubled up and tripled up. And so sometimes when we get our referrals, they may be housed. And sometimes they weren't when they were with us. And as we know, it's a cyclical and more transient. And so we really rely on our relationships with our school partners to make sure that we are serving, serving who we're supposed to be serving, and that we're also advocating for them. We help families with attending their IEP meetings because those can be intimidating. I think navigating the systems in general can be intimidating. So we get to do that with our youth, whether it's the healthcare system, whether it's the educational system, whether it's housing resources. So we really do that with our youth, and all we're really doing is alleviating barriers so that they can dream, so they can thrive. And I said we have high school seniors. Our seniors are getting scholarships. They're going to college. Some of them want to become electricians. Some of them want to be emergency medical personnel, nursing. And we also have a youth advisory council, which we have 7 youth ages 16 to 23 right now that are speaking into our work as an organization, their experience in Orange County, and really helping us leverage their voices to ensure that we are keeping them at the center of all of our decisions.
Which I love. Thank you for that overview, Shelby. Tiffany, will you share a little bit more? I know there's a lot happening over at Orangewood. Fill us in.
So at Orangewood, like I mentioned earlier, we serve transitional age youth, 18 to 24, and we have a variety of different programs. So we're really focused on making sure that we can provide for the holistic needs of youth and young adults who are experiencing homelessness, at risk of homelessness, are coming through the foster care system. And so we provide transitional housing. So we have 4 transitional housing locations. One is a confidential location for survivors, female survivors of sex trafficking. Then we have a home for young parenting mothers. And then 2 transitional housing opportunities for just the larger community, really focused on wraparound support, educational training to get them equipped in their 2 years with us to transition on to a housing opportunity that best supports them and sets them up for success. We also offer job workforce training. We have a Line Workforce Academy. We are focused on education as well. And so we have grants and scholarships that we give out to young adults who are trying to pursue higher education, but obviously have a lot of financial need and barriers to accessing, whether it's education or that financial support to go forward with that. But we're also really known in the community for our drop-in center. And so our drop-in center is open 5 days a week. We've had a 133% increase in the foot traffic since last year. A lot of it is word of mouth, but it's also because the need has increased. And so we're having a lot more young people come through our doors looking for not just housing, which is the #1 need, but just basic need support. So they need a hot meal, they need a shower, they need to do laundry, and we provide all of that. And we provide them a quiet space too. So for those that are living on the street and just want to come in and have a quiet place to sit and collect their thoughts, we offer that as well. And so our team works really, really well with all of our community partners. We can't do everything. So we also work with mental health providers, and we bring a lot of services on site. One of the things that we've heard from our youth the most is that they don't want to be sent to 5 or 6 different places to get their needs met. They're already feeling overwhelmed. They're not trusting of the system or other people. And so they feel comfortable with us. And so we vet our partners really well, and we bring on providers to do some of the mental health work, whether it's medical care, legal aid. We will bring providers on to meet one-on-one or in group settings with our youth so that they get the information, the resources, the services they need in a place where they feel safe. And so our team is, while we're here on site, we're also really community-based. And so we will meet the youth where they're at, whether it's they're transitioning from a group home, we'll meet them there. Whether it's in a park, we'll meet them there. I mean, we're showing up and we're providing support in very individualized ways to meet our young people where they're at and transition them to a level of self-sufficiency, however that's defined by their goals and aspirations.
Thanks, Tiffany. There was something that you said in there that just really made me kind of pause, which was providing people a safe place to be. And when I first started working in homelessness, I was working at a day center on the outskirts of London, and it was just that. It was a place where we offered food, laundry, showers, clothing, and it was a safe place to be. And that's a model that, when I moved to Southern California 14 years ago, 15 years, it's been a while now, a long time ago, it's a model that you just don't really see very often. And so I just love that Orangewood has created that place where young adults who don't have anywhere else to be, to feel safe, have got that place of refuge. And I can't imagine what it's like to be 18, 19, 20 and to not have the safety of somewhere to simply be. And so I just, I think so often we talk about homelessness, we're so familiar with it, we can forget the real impact and challenges that there are when you don't have a place to belong and you don't have a place to feel safe. So yeah, that just really struck me as you were talking and sharing. So thank you for that.
Welcome.
Covenant House, who is a partner in this series, they weren't able to be here today. A last minute thing came up that was unexpected, but I will share a little bit about the work that they do. So they are newer to the Orange County community, came here a couple of years ago to open an emergency shelter for TAY. And so when we say TAY, I know we're throwing that acronym around, that's transitional age youth. So now I'm the one doing it, Shelby. TAY, transitional age youth. And they operate a shelter. There are 20 beds at that emergency shelter. The shelter is based in the city of Anaheim. But just to give everybody here a picture, there are 182 young people on the wait list. 182 young people waiting for 20 beds. These are specialized beds for this age group. Otherwise, young people are having to enter the rest of the shelter system with everybody else, which I think everybody can agree that is not what we want. We don't want an 18-year-old in a congregate shelter. That's not how Orange County should be responding to youth and young adult homelessness. They shared with me that it takes on average, the average length of stay is about 6 to 7 months for a young person to be able to leave the shelter. And that's because we don't have enough housing resources to connect those young adults to. And so that lack of housing inventory in our community across the board, we're seeing it not just for youth and young adults, we are seeing it for seniors, for families, for individuals. We have a real bottleneck, and youth and young adults are certainly not immune to the negative impacts of that bottleneck in our system. They also run a rapid rehousing program for youth and young adults. And so that's the work of Covenant House that I just wanted to make sure I popped into this piece of our conversation. So we've talked a lot of numbers. We've talked about the work that your agencies do, but let's really dig into what does it look like? And we sort of started nudging our way there already. Can you describe, and Tiffany, I'll come back to you, can you just help paint a picture for us of what it looks like to experience homelessness in Orange County as a young adult?
So it takes many shapes and forms, but what we're seeing through our doors on a regular basis here at Orangewood is a young person coming in, a lot of times off the street. Maybe this young person is fleeing an unpleasant family situation. So there's things going on in their home and they're leaving their home, or maybe the youth is a runaway youth from a shelter or a group home, or maybe we're looking at a young person who was experiencing some form of human trafficking, and they're coming through our doors. And a lot of times, these are young people that if you saw them on the street, sometimes you wouldn't even know that they're experiencing a homeless crisis. And so one of the things that we really try to do when someone comes through our door, like I said, Bex, it's a place to be, but it's also a place where you can have a caring, positive person in your life. So everyone needs that support person. And so when our young people are coming through our doors, it's immediately connecting them with someone who cares, someone that will walk alongside them and support them on their journey of recovery and housing. And so I think, yeah, I don't think there's one definition of like what someone looks like who's experiencing homelessness. It takes a variety of forms. And a lot of times people want to think about, a youth or a young adult experiencing homelessness as someone who is literally on the street, which is the case some of the time, but a lot of time it's not. It's going back to what we said earlier about someone who is sleeping in a motel or maybe living in their car or couch surfing or just fled a violent situation. And so it's all of those things.
Thank you, Tiffany. Shelby, what would you like to share here?
Yeah, I think, with a lot of our transitional age youth, our TAY, we've been working with them previously in the school while they were in school. And so just like you said, Tiffany, it looks different. It's not a one size fits all, and it's not just what people see. And I think that is the invisibility of it, which makes it so hard not to understand and not to have the adequate resources and support. Earlier, when we were talking about different definitions, I'm just going to throw out a number. So this current point in time count, I think, had 300 or so TAY experiencing homelessness and almost 700 children experiencing homelessness, whereas the federal educational McKinney-Vento definition has over 25,000 just in Orange County. And so when we're thinking of TAY homelessness, what makes it a little bit different, I also think I'm thinking of two of our they were newcomers from last summer, and they were doing great in school, but they had to disenroll their senior year because they couldn't afford where to live. They couldn't afford anywhere to live, so then they had to work. And that's really sad. Like our system has failed them. Because what we do know is when youth do not graduate high school, they're 4.5 times more likely to experience homelessness. So when we're talking about transitional age homelessness, it didn't just happen when they turned 18, right? It is a cycle of homelessness that if we truly want to disrupt that, we have to invest in prevention, because we have to get it early, because when there are so many challenges and you're not knowing where you're going to sleep at night, you are on the street, you're sometimes in a car, then what happens when your car breaks down? What happens if you sever that relationship? What happens if you're no longer friends with someone where you're sleeping? All of that instability, it can just continue. And so college and career readiness, we'll do resume workshops and how to be more confident. And some of our youth are like, can I just get a hygiene kit? Can I just get some shampoo and some toilet paper? And maybe can I find a jacket right here? And it's like, yeah, absolutely. Right. So every single person is experiencing something different. Also, a lot of times, some of our TAY are taking care of their younger siblings, and now they're an active adult in their household. So they have to contribute to that household in a different way. So it looks a little bit differently.
If I could chime in, because I love what you said, Shelby, about that, really a pipeline of prevention, right? And like, how do we get to the root cause of young adult homelessness, but maybe homelessness in and of itself? So, there are different organizations and groups, and we work on homelessness sometimes in silos, where you have groups or nonprofits that are working on looking at just family homelessness or children who are experiencing homelessness, and then groups that are working on the TAY population, and then the older adults. But really, what's that cycle? And so we don't want our young adults to become chronic homeless adults, but what got them to where they're at in the first place? And can we go back and address those issues in hopes that we reduce the amount of young people that become transitional age homeless adults? So I like that. Let's go back and understand and explore where it began and start putting some preventative measures and interventions around them then.
I really love that. I just want to respond to that, Tiffany, because you're so right. Like and not only do we work in silos and homelessness, really all of our systems don't work together, right? And all of them they're designed to discharge. The hospital system, okay, we want to get patients healthy, leave the hospital. The educational system, okay, they're done with elementary school, then you go to middle school, then you go to high school. I don't know if there's always communication there. And so if there's not someone responsible for the holistic needs of humans, right? It starts when they're children, that is seeing that whole life cycle of them. Then all we're doing, it's like we're playing catch up and trying to put out fires and being responsive versus being proactive in our approach.
Mm-hmm.
Thank you so much to both of you for really digging in there. Greatly appreciate the insights that you're bringing to all of us. I would just sort of listening to you both sort of describing that, and you hinted at it, but I want to sort of bring the question back in a slightly different way to see if there's perhaps more that we want to uncover here. How is the experience of homelessness different for a young adult than perhaps it might be for an adult? And so, is there anything that perhaps you have learned or witnessed or heard as you've been working in this space that just might help anybody who's watching understand some of the unique challenges that youth and young adults who are experiencing homelessness have compared to the rest of the population?
When it comes to unique experience, I think the number one thing is going to be access to resources. I think while that's a challenge maybe for even older adults who are experiencing homelessness as well, when you specifically talk about young adults, 18 to 24, who are experiencing homelessness, they're trying to figure out life like every other young person their age, and they don't know how to navigate a system. They don't even know sometimes how to, cook a meal or do laundry. Some of the basic things that we take for granted every day, these young people haven't got the opportunity. There was no one to teach them those things. And so when we're asking them to make decisions about, well, where do you want to live? And let's get a job here and let's do all these things, but they don't know how to do the things to help them maintain those permanent housing opportunities, then we're setting them up for failure. And so I think where I see the biggest challenge and where young adulthood homelessness is different is the fact that they're still in a state of growing and learning and developing, not just in life skills, but developmentally too. If we want to talk about brain development. And so there's a lot of supports that young people need in general, but especially young people who are experiencing homelessness.
Yeah, that's I was just thinking about the brain development, and not only are they still forming that, but a lot of our experiencing homelessness, because like when I said, it's not just starting when they're 18, there's been a lot of adversity that they've been exposed to. And a well-known study on adversity, right? The adverse childhood experiences, ACEs, those affect your brain development when you're younger. And it's not just the experience of adversity, it's the prolonged exposure to adversity. So what that affects is things like emotional regulation. So our kids who have been living in this trauma and adversity for years in the educational system, in their lives, right? They graduate high school, there's no solid system for support. It's like, okay, you're 18, now you're an adult, go out and navigate this world that you may or may not have skills to navigate, but yet you are treated like an adult, but only sometimes, right? And we're expecting you to act like an adult, but you're still like, you still don't even, and when you're experiencing homelessness, think of Maslow, our hierarchy of needs. If you don't even have basic needs, how can you even get to self-fulfilling or any of that if you're hungry and if you're tired because you're not getting good sleep? And yet we're like, oh, you gotta earn money and get a job. Absolutely. Like I said, our youth, I have such a great job because our youth are absolutely incredible. But if we infuse a little bit of empathy into our systems and our expectations as a society, I think instead of saying, why are you like that? Maybe it's like, what happened? And how can we come together as a community to actually support our people? And, maybe I know I'm a social worker, but I truly think that's what I would like to do as my legacy is have some empathy in our systems, because empathy goes a long way. And I think especially with our 18 to 24-year-olds, they are just trying to figure out, I don't even know where I was 20 years ago. I was just trying to pretend I knew what college was as a first-gen student, taking the wrong classes, right? I didn't know what I was doing. I just knew I needed to go to college. And so trying to navigate all of these expectations that you're told, okay, yeah, and they have the drive, right? I want to do this. But without basic needs, that can be really challenging.
Thank you. I know we have a couple of community chats, just as you were talking, that really reminded me of some of the dialogue that we had in those chats around the impact of trauma, how homelessness impacts trauma. And so I'll see if I can message one of the team to find the links to those chats so we can pop them into the chat box for anybody who's watching, or certainly get it out in the email that we send out to everybody who's attended. And I did want to plug a little book here. As you were talking, there's a great book called What Happened to You, that talks about, and I see both of you nodding your heads. So it's a much easier to read book than perhaps The Body Keeps Score or something like that. But talking about the impact of trauma and talking about ways to help overcome and things that can really be useful tools for somebody who's experienced trauma in their life. So I wanted to just drop that little nugget in there. We are running out of time, and I know that we could all keep going here. This has been such a fantastic conversation. I'm learning so much from both of you. One of the things that was mentioned earlier was system and system change. And can you share a little bit, Tiffany? I'll start with you. Often when we're talking about like the homelessness response system, we talk about things on a continuum. Can you kind of share, where does that sort of continuum start? Where does it go? What does it cover? What's sort of the arc of services that we strive to provide in a community?
Well, I think it goes back to what Shelby was saying. It starts with basic needs. You know, it starts with being able to provide. So when we're talking about continuum care, I look at it as like holistic services and treatment, like Shelby was saying. And so providing for every component of what that looks like: mental health, physical health, even the spiritual component, housing, education, work, all of those, even the justice system, right, plays a part into this. And so it's having all of those systems work together and understand what their role is in addressing these issues. A lot of our youth, there's intersection in all of these with all systems. But we're all acting and operating in silos. And so when we're really trying to make change, how do we come together? And I know it's a huge question, and I don't have the answer for it right now, but these are things that I know that we're all curious and we want to think about. We want to, and I guess I see it as number one, starting with, let's meet the person's basic needs and let's provide them with shelter. That's the number one thing that our youth are asking for is, I'm hungry and I want a warm place to sleep at night. So let's start there. And you said that there were over 100 and something young people on a wait list to get into a shelter. So at this point in time, I see housing as the biggest need. That's what our continuum needs to address, is that gap in housing for our young people. And maybe looking at that continuum of housing, right? So from emergency shelters to transitional to maybe even some bridge housing before they get placed into permanent housing, and also not forgetting about family reunification within that process. How do we help restore and make families whole again so that you feel comfortable to go back and connect with key people, natural supports in their life? So a lot of different things. I said a lot, but really I think what I would like to see for Orange County is filling that housing gap for young people.
Thanks, Tiffany. I think that housing gap is really highlighted when we talk about that bottleneck, right? And we have youth and young adults who they need that housing piece. They're in the system and they've done what we've asked them to do. They've filled out all the forms, they've handed over their data, and now they are waiting. When I think about sort of the arc of services and sort of that continuum, I think about, as Shelby was talking about, like prevention and diversion. So how do we help prevent youth and young adults from falling into homelessness in the first place? Then sort of the next on there is outreach. And so if a youth or young adult has fallen into homelessness, how does outreach happen? How does youth outreach happen? I know we've got lots of outreach lots of outreach teams, but I'm not aware in Orange County of any youth specific outreach teams. And so that perhaps might be a gap that we have in terms of potential knowledge around outreach workers, how to engage with those who are under 24 versus those who are over 24. Then from outreach into emergency shelters, which, as we have heard and know, we do not have enough emergency shelter. 182 young people on a wait list for emergency shelter is just unacceptable, and we need to do better. And then from emergency shelter, access to rapid rehousing, access to special purpose vouchers to help resolve homelessness, access to permanent supportive housing for any youth who need that level of intervention, getting creative, room share, home share, all those kinds of housing interventions that we need a lot more of. As I've been kind of running through that, is there anything on kind of that realm of services that either of you want to jump in and share a little bit more about, where you see a need or somewhere where perhaps you think, hey, actually, we're doing well here? Would love your thoughts.
I'll jump in because I think there is a lot of great things happening in the educational system. So there's a really big push of creating community schools, meaning using the school as the hub for services for a holistic view of youth, their physical, their mental health, their social emotional well-being. I also think restorative justice practices are great because when we were talking about trauma earlier and it affecting brain development and subsequently emotional regulation, students experiencing homelessness are, they're suspended more than twice the amount of non-homeless students. And they drop out at almost double, 2.5 times, right? And so if we can interject there and instead of suspension and punishment, have some restorative practices, because then now they're like, oh, I'm the problem kid, I'm being sent to the office, I'm not even going to try. They get behind in their academics. That really stops that criminal justice involvement as well. And so I just think that that whole continuum of restorative practices, the holistic view, again, starting when they're young, is showing a lot of great work. And that's really where we partner, is that prevention piece, is ensuring that all of these pieces are in place. And there's some really great organizations and schools that are pushing for this and know that that community school approach, that restorative practice approach is working for our most marginalized youth.
I want to add, not just talking about just the continuum, right? But really looking at what does it take to do that, which is funding. And wanting to just make sure that as we talk about all these things, that we realize too that there needs to be a push on a higher level for cities, counties, the federal government to understand that in order to implement a lot of these vital programs and hire the people to give the services, that dollars need to be attached to that. And so advocacy, I think, is a huge part of this, and making sure that there's enough awareness around the approaches that we're trying to take, and that in Orange County, that we really look at being the leaders in best practices. So we want to create a continuum, but we also need to make sure that that continuum matches the needs, and that where our interventions support what our young people need to be successful. And so I think it's all of that, plus let's get some money tied around, committed to this, and let's make sure our practices are really in alignment with what we need to do to move the needle.
Thank you. I know we didn't get to drill into this too much today, but I know we will in the next chat. But I do want to highlight, nationally, we know that there is an overrepresentation of the LGBTQIA plus population experiencing homelessness among young adults. And so I just want to ask, what are you aware of in Orange County that's being done specifically to help these young adults? As we know that oftentimes these young adults are experiencing rejection from their family. And so that brings with it a whole host of other really traumatic things. And so would love to hear from either of you your thoughts on this.
Can't really speak to what's happening really in the community. I know that at Orangewood, we think about this a lot, and we're really looking at, we have a lot of inclusive practices. And so we allow our young people to speak into how we design and maneuver and function our spaces, how our spaces function. Our young people speak into that. So I say the space piece only because sometimes spaces aren't designed for that community. And so when you're looking at your bathrooms, or even when you have housing, and even in shelters, right? You have someone who identifies a certain way, but they're placed in a living quarters that they're not comfortable with. And so how do we look at the systems that we already have in place within our own organizations to make sure that we're being inclusive, that we have people speaking into how we operate before we step into the community and dictate what needs to happen on a larger scale? I think it first starts with everyone saying, hey, what am I already doing, or what can I be doing better? And then taking that information to the next level.
I would just also add a plug for a great organization in Orange County is Alianza Trans Latinx, and they're doing some really great work. It's a trans-led org specifically for trans youth experiencing homelessness. And I think exactly what you're saying, Tiffany, it starts with us and ensuring that we are always asking the question, who's at the table, who's not at the table, whose voice is being recognized, whose isn't, and how can we incorporate that in our work.
And I will say, we don't have hard data around this, but we do know that anecdotally, there is a huge amount of young people are experiencing homelessness in Orange County because they have been rejected by their family. And so that is something that I do think is important to highlight for those who are watching today, as that is just utterly heartbreaking. We have only 2 minutes left of our conversation. This time has flown by. So I will quickly ask you, is there anything that you didn't get to say today that you would like to say in 30 seconds? Shelby.
I think it's really just check our assumptions about what homelessness is, what it looks like, and start with what happened to you. And I think, again, starting with ourselves can be really helpful. And then I just want to echo what Tiffany said about funding. This takes a lot of people. We do our work, but we do it in partnership with orgs that are doing great work too, because we can't do everything. And that funding at all different levels really allows us to collaborate.
Tiffany.
As far as final thoughts, I think I will just share that the work that we do isn't easy. And we do the work because we're invested in changing lives. And I think that a lot of times we can get caught up in looking at people as numbers, but always remembering that these numbers are people with feelings, with thoughts, who experience things, and you don't ever want to lose the humanity side of the work that we're doing. But I'm honestly so grateful to work in Orange County. I think that we are set up to do great things. And I know that these types of conversations are going to lead to other dialogues, and great things are going to happen. So thank you, Bex, for inviting me on today.
Of course. Thank you to both of you for sharing your expertise, your insights, your passion. I've really enjoyed talking to both of you. This was part one. Part two is happening next week, same time, 10 a.m. So I look forward to seeing many of our participants next week. A little survey is going to pop up here. We ask these questions at the end of every community chat. We take your input seriously. So please take a moment to answer a couple of quick questions to always help us improve the offerings with our community chat. Thank you so much, Tiffany. Thank you, Shelby. It's been a delight. Thank you to everybody who tuned in. We will see you all next week.